What's good, y'all? Dr.Trehunna. So did you know the more time you spend outside, the longer you live? And do you know that studies actually show the more time somebody actually stays inside their household, the faster they die? So today, what we're going to talk about is vitamin D, or what I like to call Sunny D, right? Not the drink, and why this is important and essential for optimal human life. Okay. Now, first things first, one thing you got to understand is vitamin D is not really a vitamin. It is a hormone that is needed for your body. Okay. And it's actually needed by every single tissue and every single cell of your body. Okay. So vitamin D, because it's a hormone, it is basically a fat soluble, which means it's hydrophobic. It needs to be transferred into your system, right, through fat. Due to the fat that you actually consume exogenously, which means from an outside source, right? Now, vitamin D is so important for the human body that guess what? Your body's able to create its own source of vitamin D, not just from your food sources, but from the sun, okay? Now, because we are supposed to get so much vitamin D, and because this is the only time in human history where we always inside the house, right? You literally see that we having more chronic illnesses, right? You're starting to see that we have more depressive symptoms, and you start to realize for some odd reason, what is the main correlation? Vitamin D. So today, what we're going to cover is the main 3 reasons why you need to have more vitamin D in your life. And when it's springtime arises this year, I want you to go ahead and start making sure you go for a walk, not on that treadmill. Go for a walk outside in actual nature. That's where we belong, okay? Especially y'all black people, okay? Because we got melanin, right? It helps block the sun radiations or the UV radiations, right? But that means we need to spend outside a little bit longer than somebody who is lighter skinned. Simple, all right? Now, what is the main purpose of vitamin D? Vitamin D is the ultimate anti-inflammatory hormone, which means what? The more vitamin D you have in your body, the better your immune system is. The more vitamin D you have in your body, the less chance that you will have high blood pressure. The more vitamin D you have in your body, the less chance you're going to be insulin resistant. Why? Because everything is working efficiently, okay? So just so you have an idea of how important vitamin D is, okay? And what inflammation is basically caused due to your body being under a lot of stress, all right? Also, inflammation could be caused due to your environmental habits, such as you smoking, such as you drinking. And basically, inflammation is your body's way of protecting itself against the things that harms it, okay? So for instance, if you're somebody who got asthma, right? And you just frolicking around outside, right? And you start needing your asthma pump, that's because your immune system is overly active, right? And some pollen probably got into your system, right? And basically it's trying to get rid of the pollen. Okay, so if you're somebody who's, what's the word for it? Not asthmatic, right? But if you're somebody who actually got asthma, you're basically have an overly active immune system, right? Autoimmune diseases such as lupus, such as MS, which is multiple sclerosis, right? These are basically diseases when your body is attacking itself and it's attacking the tissue that's already inside of you, right? But this could be lowered due to vitamin D, because all of the things that I literally just named is inflammatory diseases, okay? Such as obesity. There's a direct correlation between how obese somebody is and how much vitamin D they get, okay? That's why people who are usually obese, if you really pay attention to them, right? These are people who's not spending as much time outside in nature, right? And because they're not spending as much time in nature, guess what's happening? They're getting sick more. That's why majority of the people who had COVID-19, who actually died from COVID-19, not when you actually get it, died from COVID-19. These are people that have 4 comorbidities, which is what? 9 times out of 10, high blood pressure, type 2 diabetes, cardiovascular diseases, etc. All right. So what you need to do in order for you to prevent a lot of these things is just give your body a good amount of vitamin D. Yes, you can get it from food. Yes, you can get it from eggs. Yes, you can get it from the IU supplements, right? And if you're somebody who needs to supplement vitamin D, you want to get the IUs of at least 10,000, right? But the best way to get vitamin D is taking your ass outside and going for a walk. Okay, spend more time in nature, because that's what our bodies need. That's what the sun is for. Okay, your skin is going to literally convert the vitamin D into things that works for the body. Okay, so some things that could happen if you're low in vitamin D. if you're low on vitamin D, you might notice that you might be somebody who has a lot of rheumatoid arthritis, which is a chronic inflammatory disease or auto-inflammatory disease of your joints, right? But it can be alleviated if you give your body more vitamin D, which is going outside and going for a walk, okay? Also, osteoarthritis, okay? Which is basically bone arthritis. Anything that ends with itis, okay, that means it's inflammatory, or it's based off something that's inflammatory, right? You can literally get it lowered, or you can basically make sure that the pain goes away if you give your body vitamin D. So if you're somebody who's also older, for instance, men, right? If you got lower back pain, if you ironically, if you go in and have some vitamin D supplement and you actually give yourself the vitamin D supplement, you'll come to realize that for some odd reason, your lower back pain magically went away. That's because your body needs vitamin D, okay? If you're in the northern climate, anything above Atlanta, for real, such as for me, I live in Maryland, right? Because we're not exposed to the sun as much. Why? Because it gets cold as hell outside. Nobody want to walk in the cold, right? You got to make sure that you're supplementing with a good amount of vitamin D, or when the sun does break, you need to go outside and get some vitamin D, okay? Because that's why people in northern regions, ironically, have more depressive or anxiety episodes, okay? Because your brain needs vitamin D. Okay. Also, if you're somebody who, once again, is pre-diabetic, right? You need to give your body vitamin D, because that means your body's ultimately in a chronic inflammatory state. Okay. Your liver needs vitamin D to process and do the things that it needs to do. Your kidneys need vitamin D to basically offset your adrenals. Okay. When cortisol's up, vitamin D helps lower it. But if you're not giving your body any vitamin D, cortisol is up, it's not controlled, and now it's starting to cause a lot of issues, right? Which can cause a lot of inflammation within your body, okay? And once inflammation is in your body, that's when all things start to go wrong, all right? So you need to get some vitamin D or Sunny D, all right? If you're also somebody who's a little bit older, right, over the age of 50, and you start to notice that your bones are aching, okay, that's something called osteomalacia, okay, which basically means you're vitamin D deficient, okay? And you just need a little bit more vitamin D so your bones can actually be stronger. It's going to be more dense, right? That's why you see a lot of people nowadays where, like, if you fall, you got a hip fracture or whatever, or like you fell and you break a wrist, that's because you're vitamin D deficient, right? Because what's happening is, if you're not giving your body adequate amount of vitamin D, what's going to happen is your bones are going to start to be in a state called osteopenia, which means your bones start to get brittle, right? And then you're going to get to osteoporosis, which is the worst part, which means like your bones basically is not really bone anymore, right? So you fall a little bit, you're supposed to bounce back, you're supposed to be able to get up after a fall, you break a hip fracture, and that's really the main reason why a lot of people who is over the age of like 65, they die. Not because of really like cardiovascular diseases, it's for the mere fact that you're breaking everything, right? Your body's not working as optimally because you're not giving your body any vitamin D, okay? So once again, vitamin D is important for inflammation, and it's important for your immune system. So the people, ironically, who is not getting as much vitamin D is also the people who's getting the most sick. COVID, okay? Heart disease, cancer, because your body needs this to help support the immune system. All right. So hopefully y'all learned something today. Once again, if you want to live a healthy, long lifespan, okay, what you need to do is make sure you're getting as much vitamin D as possible. There's a total difference between you staying outside and you tanning for 5 to 6 hours versus you seeing the sun break, you're just going out for a 30-minute to an hour walk. That's all you need. And once again, black people, we need more time to spend outside, okay? Because we got melanin, okay? So because we got melanin and this skin is able to protect us, right? We need to spend outside, or spend time outside a little bit more, okay? And once again, that is the main reason why you see a lot of African Americans, and I'm speaking to African Americans because I'm African American. That's what I really care about. That's why you see we're more at risk for high blood pressure and type 2 diabetes, okay? Everybody in everybody's household, especially in the African American, family, somebody got type 2 diabetes. Why? Because they're not outside. We need more vitamin D. All right. Hopefully y'all learned something today. And that's your reset tip of the day. It's going to help you stay snatched all the time, not only sometime. Go ahead and get your vitamin D, ladies and gents. Talk to y'all soon.